Hi student, in this video I am going to talk about hypertension or high blood pressure. Worldwide, 1 in 3 adults has high blood pressure, a condition that leads to heart attack or stroke. Before starting this video, I would request to all of you, please share this video to among people which help them to get knowledge about hypertension or high blood pressure, and please tell them subscribe our channel and press the bell icon to get more updates from our channel, and please like our video. So let's start today's topic, hypertension or high blood pressure. High blood pressure is a common condition in which the long-term force of the blood against your arterioles is high enough that it may eventually cause health problems such as cardiovascular disease. Blood pressure is determined by both by the amount of blood of your heart pumps and the amount of resistance to blood flow in your arteries. The more blood your heart pumps and the narrower your arteries, the higher your blood pressure. Most of the people with high blood pressure have no signs and symptoms. Even if blood pressure readings reach diagnosticaly high levels. A few people with high blood pressure may have headaches, shortness of breathing or nose bleeding, nausea, but the signs and symptoms are not specific and usually don't occur until high blood pressure has reached a severe or life-threatening stage. You will likely have your blood pressure taken part of a routine doctor's appointment. Ask your doctor for a blood pressure reading, at least even every 2 years starting at the age of 18. If you are age 40 or older, or you are 18 to 39 in between the stage of the age with a high risk of high blood pressure, ask your doctor for a blood pressure reading every year. Blood pressure generally should be checked in both arms to determine if there's a difference. It's important to use an appropriate sized arm cuff. Your doctor will likely recommend more frequent readings if you are already been diagnosed with hypertension or have other risk factor for cardiovascular disease. Children age 3 and older will usually have blood pressure measured as a part of their yearly checkups. If you don't regularly see your doctor, you may be able to get a free blood pressure screening at a health resource fair or other locations in your communities. Ask your doctor for advice on using public blood pressure machines. And there are two primary causes of hypertension. This is also a causes of hypertension. That was primary or essential hypertension. For most adults, there are no official causes of hypertensions. This type of high blood pressure, called primary or essential hypertension, tends to develop gradually over many years, and 90 to 95% of cases found in primary or essential hypertension. This is also another name, that is idiopathic hypertension. And another one, secondary hypertension, 5 to 10% of cases. Some people have high blood pressure caused by an underlying conditions. This type of high blood pressure, called secondary hypertension or secondary high blood pressure, tends to appear suddenly and cause higher blood pressure than the primary hypertension. Various conditions and medication can lead to secondary hypertension, including obstructive sleep apnea, kidney problems, adrenal gland tumors, thyroid problem, certain defects you are born with, that is congenital blood vessels, um, certain medications such as blood control pills, cold remedies, and counterfeit delivers, and some prescriptions drugs. Illegal drugs such as cocaine, amphetamines also causes High blood pressure has risk factor including age. The risk of high blood pressure increases as you age until about age 64. High blood pressure is more common in men. Women are more likely develop high blood pressure age 65. So gender is another factor for high blood pressure. In family history or hereditary, high blood pressure tends to run in families is a hereditary problem. Being overweight or obese, the more you weigh, the more blood you need to supply oxygen and nutrients to your tissues. As the volume of blood circulated through your blood vessels increases, so does the pressure on your artery walls. And not being physically active, people who are inactive tend to have higher heart rates. The higher your heart rate, the harder your heart must work with each contractions, and the stronger the force on your arteries. Lack of physical activities also increases the risk of being overweight. Using tobacco, that is addictions type. Not only the smoking and chewing tobacco immediately raise your blood pressure temporarily, but the chemical in tobacco can damage the living of your artery walls, and this can cause your arteries to narrow and increase your risk of risk of heart disease. And second hand, smoke also can increase your heart disease or cardiovascular disease risks. And too much intake of salt, which is sodium ions in your diet, uh, can cause your body to retain fluid, which increases blood pressure. And too little amount of potassium ion in your diet, uh, because potassium helps balance the amount of sodium in your cells. If you don't get enough potassium in your diet or retain enough potassium, you may accumulate too much sodium in your blood. Over time, heavy drinking can damage your heart. Having more than one drink a day for women and more than two drinks a day for men may affect your blood pressure. And stress is a major problem in our life nowadays. High levels of stress can lead to a temporary increase of blood pressure. If you try to relax by eating more, using tobacco, or drinking alcohol, you may only increase problems with hypertension. And certain chronic conditions also may increase your risk of hypertension, such as kidney disease, diabetes, or sleep apnea. And other risk factor includes sedentary lifestyle, salt-rich, high-fat diet, low potassium intake. These all are the risk factor to increase, to create your hypertension in your body. Long-term hypertension can cause complications through atherosclerosis, where plaque develops on the walls of blood vessels, causing them to narrow, and this narrowing makes hypertension, as the heart must pump harder to circulate the blood. And hypertension related atherosclerosis can lead to heart failure or heart attacks, kidney failure, stroke, amputations, hypertensive retinopathies in the eye, and which can lead to blindness. Lifestyle adjustments are the standard first line treatment for hypertension, and we outline some recommendations here. Regular physical exercise. Current guidelines recommended that all people, including those with hypertension, engage in at least 150 minutes of moderate intensity aerobic exercise every week, or 75 minutes a week of high intensity exercise. People should exercise on at least 5 days of the week. This exercise may be suitable activities are walking jogging, cycling, and swimming. And stress reductions also another way to reduce your hypertension. Avoiding or lurging to manage stress can help a person control blood pressure. Meditations, warm bath, yoga, and simply going on long walks are relaxation techniques that can help relieve stress. People should avoid consuming alcohol, recreational drugs, tobacco, and junk food to cope with stress, as this can contribute to elevated blood pressure and complication of hypertension. Smoking can increase blood pressure. Avoiding or quitting smoking reduces the risk of hypertension, serious heart conditions, and others health issues. People can use specific medication to treat hypertension. Doctors will often recommend a low dose at first. Antihypertensive medication will usually only have minor side effects. Eventually, people with hypertension will need to combine two or more drugs to manage their high blood pressure. Medication for hypertension includes diuretics, including thiazides, chlorothalidone, and indapamide, beta blockers and alpha blockers, calcium channel blockers, central agonist, peripheral adrenergic inhibitor, vasodilators, angiotensin converted enzyme ACE inhibitors, angiotensin receptor blockers. But if you have hypertension, please consult with a doctor and have start your medications after consulting with a doctor. Don't take any drugs before consulting with a doctor. To reduce your hypertension, diet plays a major role. People can prevent high blood pressure by following a heart healthy diet, reducing salt intake, because we know that excess amount of salt where present of sodium ion leads to hypertension in individual bodies. So reducing salt intake, people average salt intake is between 9 grams and 12 grams per day in most countries around the world. The World Health Organization, WHO recommended reducing intake to under 5 grams a day to help decrease the risks of hypertension and related health problems. Lowering salt intake can benefit people both with and without hypertension. Moderate alcohol consumptions. Moderate to excessive alcohol consumptions can increase your blood pressure. The American Heart Association AHA recommended a maximum of 2 alcoholic drinks a day for men and 1 for women. On your screen, this is the following would count as 1 drink. And eating more food and vegetables and less fat. People who have high blood pressure or people at risk of developing high blood pressure should eat as little saturated and total fat as possible. Instead, experts recommended whole grain, high fiber foods, a variety of fruits and vegetables, beans, pulse and nuts, fish rich in omega-3 twice a day, non-tropical vegetable oils, for example olive oil, skinless poultry and fish, low-fat dairy products. It is important to avoid trans fat, hydrogenated vegetable oils, and animal fats as well as large portion sizes. Some fats, such as those in oily fish, that is omega-3 mainly, and olive oil, have protective effects on the heart. However, These are still fats. While they are typically healthful, people with a risk of hypertension should still include them in their total fat intake. Total fat intake. And managing body weight, excess body weight can contribute to hypertension. A fall in blood pressure usually follows weight loss as the heart does not have to work so hard to pump blood around the body. A balanced diet with a caloric intake that matches the individual size, gender, and activity levels will help. This size recommended for the diets for a hypertension patient. Eat real food, no trans fat, sugar, caffeine, alcohol. Increase nutritious food rich in potassium, magnesium, and vitamins. Green color recommended for hypertension diets, and cross non-recommended for hypertension diets. And the US National Heart, Lungs, and Blood Institute recommended the DASH diet for people with hypertension. DASH stands for Dietary Approaches to Stop Hypertension. DASH is a flexible and balanced eating plan with a firm grounding in research by the NHLBI, who advises that the diet. This diet includes lowers high blood pressure, improves level of fats in the bloodstream, and reduce the risk of cardiovascular disease. Using probiotic supplements for 8 weeks or more may benefit people with hypertension. And the DASH diet emphasizes portion size, eating a variety of foods, and getting the right amount of nutrients. Discover how the DASH can improve your health and lower your blood pressure. DASH stands for Dietary Approaches to Stop Hypertension, and the DASH diet is a lifelong approach to healthy eating that's designed to help treat or prevent high blood pressure or hypertension. We know that blood pressure readings are given in two numbers. The top number is the maximum pressure your heart exerts while breathing, that is systolic, and the normal value of systolic blood pressure of a humans is 120 mmHg, and bottom number is the amount of blood pressure in your arteries between beats, that is diastolic, and the normal value of diastolic blood pressure in human, that is 80 mmHg. And according to European guidelines, stage 1 or pre-hypertension is 120 per 80 to 139 per 89. This one upper systolic blood pressure is 120 and diastolic blood pressure is 80 to the systolic blood pressure 139 by diastolic blood pressure 89. First is systolic and second is diastolic, and stage 2 or mild hypertension is 140 per 90 to 159 per 99, and stage 3 or moderate hypertension is 160 per 100 to 179 per 109, and stage 4 or severe hypertension is 180 per 110 or higher. And according to the American Heart Association, this row is blood pressure category. This is the normal. The systolic blood pressure, which is mm per Hg, upper blood pressure, less than 120, and diastolic, which is measured by mm per Hg, mmHg, less than 80. Elevated, that is the systolic blood pressure in between 120 mmHg to 129 mmHg, and diastolic is less than 80. And high blood pressure, which is stage 1 hypertension, The systolic blood pressure is in between 130 mmHg and 139 mmHg, and diastolic is 80 to 89 in between mmHg. High blood pressure stage 2, 140 mmHg or higher or 90 or higher mmHg is diastolic, and hypertensive crisis, that is sick emergency care, higher than 180 mmHg in systolic and higher than 120 mmHg in diastolic. So in this video I discussed about the hypertensions, what is hypertension, what is the causes of hypertension, what is the risk factor of hypertension, and the management and treatment of hypertension. So please share this video to among the people who suffer from hypertensions. If you like this video, please share this video, and please don't forget to subscribe and press the bell icon. Thank you for Knowledge of Life.